Welcome to Shape of the City. I'm Diane Gonzolas, and I'll be your host for this segment. February is National Heart Health Month, and to learn about staying heart healthy and the risks of heart disease, let's visit with Dr. Dennis Korpos from the Nebraska Heart Institute and Heart Hospital. Dr. Korpos, thank you very much for being with us today and taking time out of what I'm sure is a very busy schedule. Let's start off with some general questions. Talk about the leading types of heart disease.
When you talk about heart disease, we're looking at certain types of illnesses. When you have somebody who says, I have a heart problem, typically the first thing thinking about is ischemic heart disease, meaning the diminished blood flow to the heart muscle. And in the forefront of those are heart attacks. So typically that's what most people are concerned about. But besides that, we can talk about heart failure, which is the weak heart muscle, and also another third portion is arrhythmias, rhythm disorders, irregular heartbeats. And typically, heart disease encompasses mostly ischemic heart disease, which is diminished blood flow to the heart muscle.
We'll talk about some of the causes of heart disease. I know most of us are familiar with the common ones, the cholesterol, the being overweight. What are some of the, again, more common, but maybe some that people don't know?
I think when we talk to patients, I really emphasize family history. That's something that's really important, and some people do ignore that. If you have somebody in the family that has heart disease, you have to be extra vigilant. That's something you cannot really do much against. It's your genes. You can do everything else, exercise, quit smoking if you smoke, or never take up smoking, control your blood pressure, know your cholesterol. But I think one thing that's often missed is, if you have family history, if you feel healthy and you are healthy, looking back, who had, like your dad had a heart attack at age 50, those are the times that, you're probably, in that age range, you want to actually have yourself checked out probably, sooner than you would if you didn't have those problems in the family.
What exactly is a heart attack? I know it's a really common phrase, but are there different types?
There are some types, but the basic principle is diminished heart blood flow to the heart muscle. So typically a heart attack is a blockage, a blocked artery, which will not let the blood flow go to the heart muscle. So this is actually a result of a blockage, a plaque, we call them. Cholesterol typically spills out of the plaque, and then you have a blood clot sitting on top of that. So when you have a blockage, some people have chest pain. We talk about maybe an 80-90% blockage. The blood flow is blocked to that extent, but there's still flow. When you have a heart attack, that flow becomes zero. So you have a clot on top of a blocked artery, and you have an emergency. You have actually a certain time within which you have to restore the blood flow, unless you end up with scar tissue and heart damage. So the heart attack is a blocked flow when typically the vessel is completely closed.
And what is that time frame?
The time frame, typically if you get to the emergency room and you have your artery open within 90 minutes, then you will have no heart damage. And that typically is a time, from the onset of symptoms. And if you wait longer, typically after 4 to 6 hours, then you do have some scar tissue down the line. Typically we say, if you have a pretty good chance, the golden hour, we call them a golden hour, in 1 hour. Typically if you have the blood flow restored within 3 hours, typically you have no heart damage down the line.
Well, statistics say 70% of people drive themselves or have someone drive them to the hospital when they suspect they're having a heart attack. Talk about why it's important to call 911 and the 12-lead technology that we have here that can really reduce your chances of permanent damage.
Sure. Although it seems convenient to have somebody drive you to the emergency room, that's not a good idea. Typically, if you have a heart attack, you can have sudden onset of rhythm problems. So you can actually have issues in the car when you're driving yourself or someone drives you, sudden cardiac death, and if you're in an ambulance, you have a much better chance of making it as if you're driving in your own car. So I think it's very important to call 911. In addition to that, they can get an EKG down the line on the field right on you, and they can actually alert the hospital. They can get prepared for you. They can give you initial treatment such as aspirin, nitroglycerin. So it's very important to call an ambulance. Your chances of making it alive at the hospital are a lot higher if you call 911.
All right. Well, let's talk about who is most affected by heart disease here in the community and nationwide.
Typically people who do have risk factors. The risk factors we typically list age, which is something that you cannot do much about, family history, smoking. Unfortunately, the smoking cessation has really has been importantly increasing here in the U.S. I grew up in Europe. Every other person smoked. So I think in the United States, I was happy to see that the smoking has really gone down significantly. Mm-hmm. What has gone up, however, is obesity. If you look at the obesity trends, it's sometimes very scary. So I think overweight society is a problem, especially if you look at down the south, southern states. I think obesity is definitely, will put patients at risk for a heart attack. Blood pressure, high cholesterol. It's been shown that only about 1 in 10 individuals know their cholesterol levels. So it's important to know that number, and guidelines are recommended to be tested early on. So I think those things are very important.
If you know that you're at risk, say you're overweight, you have a family history, your cholesterol is high, what are some things that you can do to reduce your risk?
Know your numbers and do exercise. Exercise is very important, diet and exercise. I have patients that typically spend 0 time on the treadmill, or some people very faithful about exercising. And what we typically say, you get your heart rate up about 10, 20 minutes, at least 3 times a week. So that's something that's very important. Even 5 minutes of exercise is helpful. Your risk of heart disease will be reduced significantly if you do those numbers. But again, any exercise is better than nothing. Break out a good sweat, get your heart rate up. So those are very important. And you know your numbers, know your cholesterol numbers, know your blood pressure numbers, and eat right. And again, some people are very strict about diet, some people are not. I think to be reasonable, we always promote fish, a few times a week. The so-called Mediterranean diet, which again, it doesn't always have to stick with certain exact numbers. I think be reasonable. A lot of olive oil, fish, and try to reduce red meat. It's hard to do in Nebraska, but that's probably what is important as well.
A lot of people are maybe confused about when to call 911. Talk a little bit about the symptoms of a heart attack, and also a little bit about how the symptoms might be different between men and women.
Yes. Typical symptoms of a heart attack are chest pain, chest tightness. A lot of times when I talk to patients, they say, I have no chest pain, I have tightness. So that's something that's important. Most commonly, people have a sensation that someone's sitting on their chest, a pressure, a band, a burning sensation. So that's very alerting. However, a lot of people, especially women, don't have those symptoms often. Sometimes have sharp pains, they have anxiety attack type of symptoms. Sometimes they have shortness of breath, pain in their back, palpitations, sensations of rapid heartbeat, just fatigue, and sometimes just anxiety. So I think, if you have risk factors and you have family history and you're a woman and you have those symptoms, it's very important to actually, be safe than sorry. So if you have those symptoms, do alert your healthcare professional, call 911, come to the emergency room. One other thing that's important, and sometimes, it's missed. Most commonly it's missed, indigestion. Some people, have a meal at night, they go to bed and they feel that they have heartburn. It's probably just some spicy food. Doesn't go away, if they take antacids, still persisting. Some people say, I'll sleep on it, see how I do in the morning. That's a dangerous path to go down. A lot of times when you have those symptoms that will not go away, heartburn, indigestion type symptoms, if you do have your risk factors, call 911.
All right, we're going to get a little technical here. This is a question that your staff sent to you, so I don't want people to think I'm smarter than I am. The difference between a radial versus a femoral treatment approach.
We talk about radial, and femoral, we talk about a heart catheterization. So when you have a heart attack, you put a tiny tube in those areas. It used to be the femoral, which is the femoral artery, which is in your groin. So the femoral means a groin approach. You put a tube in the groin and go up through that way to actually look at your blood vessels. In a heart attack situation, the blockage is there. The clot can be fought with medication, but the blockage does not go away. So, if you have a heart attack, we go up there and then fix the blockage, typically with a stent. And traditionally, that happened through the groin. Still, in the U.S., about 50%, 60% of the cases are done through the groin. In the radial, which is your wrist, the vessels are smaller. It's more difficult to put a tube in there. However, that's a safer approach, meaning that the bleeding complications are less, and also in a heart attack situation, it has been shown that if you actually put the tube in your wrist, your outcomes might be better. Safer approach, less bleeding. This vessel is compressible. It can put pressure on the bone when the radial artery runs, on top of the bone, as opposed to femoral. So that's actually a more convenient, safer approach. Also enables patients to get up a lot sooner. So when you put a tube in a groin, you have to lay flat after the tube is taken out for hours. With the radial, you can sit up right away. Early mobility, patients are more comfortable with that approach, and we do have better results as well through the wrist. So that's the difference between the two.
All right, let's wrap up by talking about where viewers can find out more about heart disease and how to stay heart healthy. I know a lot of us Google things, and we're never quite sure which information that you'll find online is correct. I trust Mayo Clinic, but I'm not, that's the one I usually go to.
Sure, I think there's a lot of good websites that will tell you that. One thing that I think it's important, and it's a nice one, I just looked that up because I had this question, how old is your heart? And we had that question, and there's a website called heartage.me. So you can actually go on that, and you can put on different scenarios, and then we'll tell you how old your heart is. So
it's heartage.me.
Heartage.me.
Okay.
And what typically you want to know how old your heart is. You want to at least look at if your heart's age is matching your age, and preferably younger than you are. Typically those variables are smoking, cholesterol level, family history, height and weight. Again, obesity is a problem. So we put those variables in, then we'll give you a certain age, and hopefully when you get is younger when you are. So that's a good website.
And cholesterol, you probably need your cholesterol number in order to go on that website.
Yes.
How often should you have your cholesterol checked?
Typically they recommend to have that done in the 20s. And I think if your numbers are good, that doesn't have to be that frequently. However, if you're high cholesterol and get treatment, typically after a treatment is initiated, we recommend 6 to 12 weeks, 3 months after. And after that, probably at least once a year if you're on treatment. If your cholesterol is good, then probably don't have to be checked that often.
All right. Dr. Korpos, this has been very interesting. People think they know a lot about heart health and heart attacks, but this is learned some new things today. So thank you very much for that. Thank you, and good luck with all the work that you are doing at the Heart Hospital to help people stay healthy.
Thank you very much for the opportunity.
And when we return, Clover Frederick will learn about an initiative working to save lives through early breast and colon cancer detection. Stay with us for more Shape of the City.
We women sure know a lot of numbers by heart. But do you know the most critical numbers for your heart health? That knowledge could save your life. Do you know your numbers? Talk to your healthcare provider today to learn your health numbers. Your heart depends on it.
Nuestros cuerpos dicen una historia. Cada una es increíblemente única, moldeada por nuestro historial familiar y pasada de una generación a otra. ¿De dónde heredaste tus ojos, tu sonrisa y la pequeña arruga en tu nariz? O quizás tu riesgo de enfermedades del corazón o de ataque cerebral. Como mujeres, debemos unirnos. Busca tu historial, conoce tu riesgo, protege tu futuro.
Welcome back to Shape of the City. What do more than 179 primary care providers in Nebraska have in common? All of them are part of a project called the Nebraska Physicians Screening Initiative. Today, we'll learn more about the progress and goals of the project with Dr. Bob Rauner from the Partnership for Healthy Lincoln and Dr. Mike Rapp from the Physician Network. Thank you both for joining me.
Thank you for asking.
Well, Dr. Rapp, let's start with you. Tell me, what exactly is the Nebraska Physicians Cancer Screening Initiative?
The Physician Screening Initiative is an effort to improve screening for colorectal cancer and for breast cancer in our citizens. It was started by Partnership for a Healthy Lincoln, which Bob Rauner started, and it's morphed into Partnership for a Healthy Nebraska because it's been so successful. We're trying to increase the rates by which all Nebraskans of the appropriate age and sex are screened for these two cancers that take so many lives every year.
Great. Now, who's participating in this initiative and how is it really getting into the community?
Well, it's actually across a number of different networks. Mike and I were at actually a meeting about a year and a half ago and kind of talked about could we bring our various organizations together, and started pitching it to clinics in Lincoln initially. We have clinics from the Physician Network, which is kind of aligned with Catholic Health Initiatives. You have One Health Nebraska, which is independent clinics, some of the safety net clinics. So initially started with just Lincoln clinics, but then as it started off, we actually had some interest from some of the other clinics in his network. So clinics in Crete, Kearney, Nebraska City got involved as well. And so now where it's even expanded to federal qualified health centers across the state as well. So.
Great. So how is this going from the physician to actually helping the patient?
Well, one of the reasons that, unfortunately not enough people get screened. Right now, probably around 60, 70% maybe at most are getting screened. The goal is to get that to at least 80% by 2018 as a national effort. And so we started looking at our rates and finding out in Nebraska at least a year and a half ago, probably closer to 50%. We've gotten some pretty significant increase already. And so getting those people screened, and what they found the most common reason people say I didn't get screened is my doctor never mentioned it. Oh. And so we tried to institutionalize it. So part of when every clinic has patients for their annual wellness exam, for example, that's one of the things they ask for, and then they track it actively. So all of Mike's clinics, they pull a number every now and then and say, okay, where are we at now? And then a couple months later, they'll pull again, okay, where are we at now? So they really set a goal for themselves.
It is the kind of screening that can't just be the physician's responsibility. In TPN, we found that it has to be the entire clinic, everyone, from the person at the front desk to the person that checks you in. Everybody has to be involved in this to make a difference.
Good. What are some of the results you've seen so far?
Well, mostly just getting the clinics to the point where they have better data they can pull and find out now that they have electronic record programs, where are we? Pull that number, see what it is, and can they make it better over time? And so I think one of the biggest things is finding out what works and what doesn't. One of the biggest barriers we're finding in the safety net clinics, unfortunately, is just lack of health insurance. There's people who get reminded and they're interested, but unfortunately don't have the health insurance to cover it. We started moving some other things, so we actually have the county medical societies working, or the Lancaster County Health Department's working on this. Dave Hum and their Cancer Coalition, they have offered free FOBT kits, which is a way to screen for blood in your stools, for example, if that's a symptom, that's something you'll see in colon cancer. So the health department's also working on this a little bit. The Cancer Society and Tamara Robinson have also been involved, so they're trying to do some messaging out in the community as well.
We've seen a definite improvement in screening percentages. Within the reporting, it's gone from as low as 30% up to 60% for either of the screenings, depending on the clinic. Some of that was, as we said earlier, because the entire clinic began to change how they do things and how they record it. But I believe that there are lives being saved because of the true increase in patient screening, not just statistics, but more patients are having it done.
Great.
Yeah. And most of the clinics made a significant improvement, some quite a bit dramatic improvement. We also have some state data coming in now, though, where we actually can compare Lincoln and Lancaster County, the rest of the state, and we actually now know that actually Lincoln and Lancaster County has the highest colorectal cancer screening rate in the state right now, and for breast cancer, we're pretty close to the top as well.
Very good. What have been some of the biggest challenges to getting people in for early screening? You've sort of touched on this. It could be that they weren't reminded, could be a financial barrier. What else?
Sometimes the screening is unpleasant. Women that get mammograms complain about it. Nobody particularly enjoys colonoscopies. And so you have to get past that mindset as well and make sure they understand the consequences. It can be quite severe, life-threatening, if they do not do the screening.
Do either of you have any personal stories from this project that you can share so far?
Well, we have our own relatives, for example. I have an aunt that had cancer, colon cancer, and then treated. Luckily, she survived. I think one of our best stories actually is one of the clinics, the lead physician, her own father saw one of her partners, hadn't been screened. They got him screened, found out he actually had a precancerous lesion. And so she's kind of a believer in this project because her own father got a cancer caught early or before it became cancer and probably prevented that. And I think that's one of the biggest things that for colon cancer specifically, colonoscopy, not only does it detect cancer early, you can actually find polyps before they become cancer. And so you avoid the chemotherapy and radiation surgery altogether. And so there's really a solid argument for the colonoscopy side.
Good. How do people find out more about colon cancer screening or breast cancer screening in their own community?
Paying attention to the American Cancer Society ads, talking to their doctor.
Yeah, I think that one of the best things is frankly coming in for that annual exam and a wellness visit. Almost all insurance plans now cover an annual wellness visit. This is one of the biggest things that are accomplished during that, is to make sure that you've been screened with the things you should be screened for. And I think a lot of people forget that a lot of insurance covers this with no copay or anything. There's a reason why Medicare, for example, wants you to come in for this, because they know that, well, not only will it help prevent illness, it actually might even save them money because treating cancer is really expensive.
Okay. Well, now somebody who isn't quite at the age yet, I'm not even sure what the appropriate age is, so why don't you tell our viewers what is the right age for or recommended age for these screenings?
For both of them, it's starting at age 50.
Okay.
For some women, you may be doing mammography at a younger age, but for the routine, everybody between the ages of around 50 to 75 should get screened for both of these. Okay. There are some high-risk conditions. So for example, with my family, my aunt she had colon cancer in her 40s. It's a little bit younger age, because if you have a family history, that puts you at a higher risk. Same thing goes with breast cancer. So some women, for example, have a hereditary form of breast cancer that can go through their family. They have a little bit different. For routine screening, it's between the ages of 50 and 75.
Very good. Okay, well, thank you both for joining me today and letting us know more about this important initiative. Thanks. When we return, we're going to learn about some more important health information.
Imagine a world with more birthdays. Imagine a world where cancer is scarce. Getting tested for colon cancer can help you celebrate more birthdays with those who matter most. Imagine how happy your family will be to have you with them year after year. Picture yourself spending more time with your friends and family. Call your doctor and make an appointment today. Anyone can get colon cancer, both men and women. If you have a colon, you're at risk. If you're 50 or older, talk to your doctor about colon cancer. Your friends and family will be glad you did. We're the American Cancer Society, the official sponsor of birthdays.
Valentine's Day is like a box of chocolates. You really never know what you're going to get, and sometimes the last thing you want is a box of chocolates, especially if you're really trying to work on your health. We've got some other solutions that you can really use that can be a little healthier and maybe incorporate a little chocolate, but yet keep it healthy. I love to do chocolate dipped strawberries this time of year. All I do is I take about a cup of chocolate chips. If you can use dark chocolate, especially around the 60% cacao or the darker semi-sweet chocolate, that can work great. I use a cup of that with just about a half a teaspoon of oil. I put this in the microwave for about a minute to 30 seconds at a time, stirring until it becomes liquid like this. Then you basically just take a strawberry that you've washed and you really dried thoroughly, dip it into the chocolate, and then put it out so that it has a chance to firm up. One trick that I use is I dunk my fruit through a little bit of ginger ale or diet ginger ale because the citric acid helps to keep that fruit from browning. Then I make sure and dry off that fruit real well before I put it into the chocolate so that the chocolate doesn't seize and get hard on me.
Think about all the different fun things that you can dip in chocolate. You can really have a lot of your favorites and have it work out. Maybe I've gone too far. Happy Valentine's Day.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com.